When a patient comes in to see you, 10% of the time, they have very high need, they're aware that they have a big problem, and you could be the worst chiropractor in the world, and they're gonna listen to you and do exactly what you say. They walk in, you guys know who I'm talking about, you're like, you got neck pain, that's a big deal. Yeah, it's a big deal. It's gonna cost you $2,000 to fix it, no problem, I don't care, let's get this fixed. They require zero skill on your part, right? And there's 10% of the patients who are really obnoxious, don't care what you say, and are never gonna do what you recommend. You guys know those two, right? Mm-hmm. They're not going to listen to anything you have to say, and it doesn't matter. I mean, there's people who do that with cancer. I got cancer, doctor said I have cancer, I'm not doing the treatment. They're just obnoxious like that. But 80% of the patients are gonna make a decision based on your skill level. If your skill level is high, you're gonna capture 50% of them, or 60%, or 70%. If your skill level is low, you're gonna capture 20 or 30%. My need is so critical because it's the motivating factor. It destroys all obstacles. You don't have to be good at resolving obstacles if you can get need high enough, if they have an abscessed tooth, or if it's their daughter. But you're not creating need. You never create need. Creating a need in somebody is called sales. I have something I want to sell you, you don't need it, I'm going to give it to you anyway. The big problem with need is when you try and get people to admit they have need, because that's your goal, is get them to recognize they have the need. It's there, you got to bring it to the surface, right? But when you try and do that, if you're trying to convince an alcoholic to stop drinking, how hard is that?
It's one of the most difficult things.
Incredible. It's the same thing with trying to convince somebody who's a member of a cult to leave the cult, right? Change their religion. Or convince somebody to stop smoking. Or convince somebody that stop being angry or ruining your kids. It's really hard to get people to face and admit their needs. So it requires a high skill level, right? The only way that you can get somebody to increase their need effectively is to get them to talk themselves into it, which is why we use questions. If you ask the right questions, in other words, active listening is how you actually convince people to do something. Active listening, remember, active listening is all about control. Passive listening, who's in control? You guys understand the difference between active listening and passive listening? Passive listening is, Brian, tell me about your day. Tell me about your relationships. Tell me about your habits. And you do whatever you want to do. You talk about whatever you want to talk, and I just listen. Active listening means what?
That you're guiding it, and it's all about control. Like the other one, you're giving that
all
control.
About control.
You're listening, but you're guiding the conversation to the direction that you need it to be.
You're talking, but I'm only going to allow you to talk about what I want you to talk about. You're only going to feel what I want you to feel, and I'm going to force you to say what I want you to say. The first thing you do when a patient comes in the room is you just don't go, tell me how pathetic you are because you can't wipe your butt because of your back pain. You don't. You say, how'd you hear about our office? Good experience with chiropractors? You know, what's going on? Tell me about your life. And you let them control the situation from the very beginning, grab a few details, bond with them a little bit, show some love, show some concern, touch them, right? That's why we touch them, because we're creating all these warm fuzzies, we're creating trust, we're showing concern, and that's why we don't go for need immediately. We build a little bit of trust and rapport, then we ease into need gently, right? But, and also because it's so painful and uncomfortable to talk about your alcoholic nature and your drinking on the job, we have to, but the mistake that most chiropractors make is they won't ask those hard questions. See, as we dig and dig and dig and we go deeper down the rabbit hole, using our active listening skills, we're carefully peeling away the layers, looking for that raw emotion, and then we start to get close, remember, 80% of the time, 70% of the time, this isn't a problem. The issues aren't that, we're not dealing with alcoholic people. We're people who are in pain who want help. See, so that's why, but still, if it starts to get uncomfortable and we start to get to the bottom and their real needs, that's when the chiropractors back off and they won't ask the hard questions. You saw it with Singleton, right? Whenever it started to get awkward or uncomfortable, he would stop, and I use the example of where they talk about moms who come in, and I can't care for my kids, and it's affecting my relationship with my kids, and I feel like a bad mom. Well, if you just simply say, how's this affecting your ability to do the diapers, do the laundry? Oh, I can't do the diapers. I can't change. It hurts to breastfeed. It hurts to sweep. It hurts to vacuum. And then we stop and we write in the chart note, primary need is can't do chores, can't do housework, right? And that's where we stop. She goes, yep, that's my main complaint. I can't do the laundry. Well, no one wants to come here and spend $2,000 because they can't do the laundry.
You can pay some to do the laundry.
You can pay some, but exactly, that doesn't make any sense. But the question you have to follow up and ask is get to the emotional spot. When a patient comes to you and says, it hurts when I exercise. That's what Travis says. It hurts when I exercise sometimes. Oh, and then the follow-up question is, what? How would you increase that?
Is exercise important to you?
Yeah, do you think exercise is important to Travis?
Yeah.
But the big thing is what we're trying to do is get to the point where you say, what would you do if you couldn't exercise? He actually limits his exercise because of his back problems, right? What would your life be like if you can always switch to the positive, but negative always works better? Why does negative work better?
Because people want to move away from pain.
It's always moving away from pain is way more important than moving towards pleasure. Offering somebody, So when you're dealing with mothers, it's always, the big problem that I always see is doctors will get need. Oh, this affects your job. This affects your ability to work. And then they stop there and they go, work is a big deal. How would your life suck if you couldn't work, Joe? What if you got fired today?
I'd be homeless.
You'd be homeless. Is that a big deal? So is that, but is your job important to you?
Yeah.
Yeah. And if you said my back hurts to the point where I can't work, you'd be like, that's a big deal. But what I haven't done is, you've thought about it for a second, but what I haven't done is evoked an emotional response. So if I push too hard with patients and make them feel too crummy, I'm a used car salesman, I'm a con man, they hate my guts and they want to move forward. If I don't push enough, they're not going to be motivated, and they'll do what I did to the first dentist I went to, and go, I can find somebody else, I can find somebody cheaper. So that's why everything we do on a day one is a balance between building trust, building rapport. It's all about building trust, and at the same time, eliciting the emotions. So you're either going to piss them off, or you're going to not create enough need. And where does the problem usually stem from? Are we usually
Not creating enough need.
Yeah, we don't create enough need. So you're literally trying to create, I'm literally trying to create with all of you in here, how do I motivate and push you to be the best employee you possibly can be without pissing you off, right? Yeah, the amount of criticism, if I criticize Erin, honestly, if I give her the tiniest bit of criticism, if it's legit, she'll take it, she's professional, but it impacts her 10 times faster and harder because her tolerance to making a mistake is really low. Am I wrong?
No.
If you make a small mistake and I call you on it, I can upset you really fast. If he makes a small mistake and I call him on it,
Upsetting me, I'm upset with myself.
yes, you'll get, either way, you're upset.
Yes.
If he makes a little mistake, he doesn't care. And if I call him on it, he just gets annoyed, right?
What?
Yeah.
He
And
tells you he
Joe
likes
doesn't
to
even get
provoke
annoyed.
you.
He's like, yeah, whatever. It's a little mistake. You know, it goes right off his back. It annoys him and it motivates you dramatically to never do it again. It's very different for each person. But the thing to remember is when you're pushing need on people is that they want you to do this. They appreciate it. You just can't push too hard, you know. A boss-employee relationship is very different than a patient relationship. But the point is you want to push as hard as you can. Make sure you get need. I guess I'm just rambling on it. I think you guys get the idea.